It's extremely bad. As you know, that the general challenge that we've been speaking about since March has been the inadequate PPEs. And secondly, the issue of not having protective measures in a form of establishment of a health and safety committee. But now we are really facing a new strain in a form of the number of people coming to hospitals with having tested positive for COVID, but others because of the consumption of alcohol being stabbed, and also others because of car accidents. And we are expected to attend to those people at a go.
Yeah.
And you will recall that since March we have not been sleeping. We are working around the clock, and there is no appreciation on the side of government, even a form of motivation, in a form of incentive. So we are in that kind of a situation now.
Are you hearing of people being turned away at public hospitals at all because there's simply no space?
The incident that we know is in one hospital in East London where the beds were full and people ought to wait inside ambulances because they could not have been taken out to the hospital because there were no beds. But we are just getting some information as we are preparing a meeting with the minister tomorrow in terms of such areas. But we know that incident as it occurred. And also we're hearing that provinces like Western Cape, Eastern Cape, and now KZN, they are in trouble in terms of space to accommodate the new ones coming in.
Yeah. So we know that the National Coronavirus Command Council is meeting to discuss possible stricter measures. What do you think should happen to address this high infection rate we're seeing?
Really, three things that we think that there must be of consideration. The first one is the issue that should motivate these strained healthcare workers to triple their efforts. And we do think that they must find a kind of an incentive to do so because they are really tired now. But secondly, we do think that they must also look into a different way of mindset that will help society to recognize that this second wave is real and the new variant kills. So it's important that whatever information and education that we bring now should be relevant and should be simple and should be factual, as opposed to a number of distortions. For instance, the society, when we were confronted with the first wave, have been orientated on the narrative that the virus only becomes vicious in winter. Now we're in summer, and people, as a result of that narrative, had to behave the way that they've behaved, and as a result, there was just a general complacence, even in hospitals and so. So we need to really to bring accurate, in a smart way, information for public to pick up the reality and also help them to educate. But the important is the last issue that really we think that the command center must focus are the extreme restrictions that needs to be considered, not at the level of only focusing on alcohol, but they must also consider many things that needed to be looked into, including reviewing the alert level 1, perhaps tidying up, maybe taking us to level 2 to 3 with the stricter restrictions so that we are able to manage the movement. As you will know, that is that time of the year where everyone else will be enjoying holidays and want to move. You know?
Yeah. Thank you so much for your time. We appreciate it. Zola Sapeta.